Hello and welcome back to Bedside Murmurs, a podcast where we chat with doctors and medically minded people about their careers, pathways in medicine, clinical tips and much more. If you have any questions or have any ideas for guests that you would like to see on the show, please shoot us an email at podcast@medsoc.org.au. That's podcast@medsoc.org.au. My name is Emily.
And I'm Sean, and we will be your hosts. Today we're chatting with Dr. Isabella Townshend, who's the founder of Balanced Medics. She currently works as a leadership, career and mindset coach, and she is passionate about developing medical professionals in their medical careers and beyond. She is also a strong mental health and well-being advocate, and utilizes a platform to drive change in the medical field. Welcome, Dr. Isabella, to Bedside Murmurs.
Thanks for having me.
Could you tell us a little bit about your career pathway and how has it progressed?
No, I think it's been a winding pathway with lots of different paths outside of medicine that I've explored and taken. So I went to Western Sydney Uni straight out of high school, so I was 17, couldn't go to O-Week stuff, I was underage, that kind of thing. So just a straight out of high school onto the med path. And my initial vision was, do med school, I didn't really actually know what happened after medical school. I thought I'd just be a doctor and that's it. But obviously there's more training that's involved. So third year was the year that I was rethinking things. In Western Sydney, you're full-time clinical in third year. So every day you're in the hospital and they are very strict on attendance. So you're there like the beginning till end of shift. Sometimes you do on-call shifts, weekends. And it was quite a lot. I was a very introverted person, and then you have to meet all these different teams. I don't know if anyone else relates to that, where you have to say hi, make new friends, meet new nurses, registrars, all that. So by the middle of the year, I knew I wanted a year off. So I deferred fourth year, went traveling, went to South America, learnt Spanish, met my future husband, so did a lot in that year, and then I came back to finish medical school. And then by the end of med school, I was definitely doing better by then. I think just having a bit more life experience helped. And then I took another year off. So before internship, I got Wollongong, and I wasn't so keen on going to Wollongong. It was my last preference in stacking. So I was like, that didn't work out. I'll take another year off, travel, which was really good because that was 2019, and we all know what happened.
Well planned.
Yeah, I know. I had no idea what was coming, but I thought, either I'll take time off after residency or take time off now. And luckily I did, because it wouldn't have happened really after that. So started internship January 2020, COVID, all of that right in the beginning.
We love that.
We love that. Trigger warning for everyone. But yeah, so it was very interesting to see it develop. We didn't know how to test for it. Internship's hard, so with COVID as well makes it more challenging. And I guess I was not quite sure what specialty I wanted to do by that stage. I was thinking critical care. I loved my anesthetics, rotations and procedural skills, all of that. And then I started rethinking, is there something else outside of medicine that I would like more? And also lifestyle, right? So what do I enjoy doing outside of medicine? How much time I want to spend with family, friends, my husband. And so I finished intern residency, and I didn't really know what to do next. And I didn't apply for a job in residency. So it was a bit scary. Everyone was applying for jobs, but I wanted to just explore and see what else I could do. I was thinking I could locum if I had to, or maybe even do something completely different. And I got a clinical research job.
Oh, congratulations.
Yeah, well, that was...
Well, then.
But thank you for then. This was 2022. And it was really interesting. So it's the more pharmaceutical side, more industry, which I think you don't get much exposure to in medicine, that side of things. So clinical trials phase 1 to 3, learned a lot, and it's definitely a great career path for people that are interested in that kind of thing. But that's also when I found coaching. So I signed up to a beginner coaching course with the Coactive Training Institute, and I just loved it. It's really all about personal growth and development, reflecting on your values, on how to ask questions. So instead of a medical diagnosis type where you try to narrow down it's about broadening things and opening up possibilities. So yeah, I did that. Signed up to the rest. I'm doing certification currently to get internationally. So there's an international coaching federation. So working for that, you need like 100 hours of paid work. So I have a lot of doctor clients, and it's really great working with doctors because they're such talented individuals, just so resourceful, and I think it's just really rewarding to see the growth and the change and how doctors can just take back their life, take control and feel more autonomous with what they do. And it's not about saying you need to leave medicine or do this or that. It's just about finding the right way for you and your life. And also I'm not completely out of medicine. I still locum, and I'm doing my Master of Public Health. So I'm really interested in the public health side of medicine too. So I know it's a bit of a winding thing, but I guess I just follow where my interest takes me at the moment.
Yeah. Could you tell us a little bit more about coaching and what is it specifically? I think most of our listeners are medical students. They wouldn't have too much experience within this kind of sphere. What would be like a quick like rundown of what is it that you do on a day-to-day basis, and what do you like usually help your clients with?
Yeah, so coaching is about asking powerful questions and helping the client find their own answer. So it's not like consulting or therapy or anything like that, and you're not telling anyone what to do. It's about asking questions that get you thinking about things you don't think about, because I think you can run in your head over and over, get stuck in what am I going to do about this? What am I going to do about this? But when someone asks that question that gets you out of that cycle, you can have breakthroughs. So coaching's a lot about powerful questions. There's other tools that you use, but to get someone to just reflect and go below the surface of what you might normally be living in. It can help with dealing with certain emotions you might avoid as well. And it's different from therapy in that it's very now, it's very in the present, and then also a bit about future and goal setting. So where do you want to be in a year, and how do you get to where you want to be in a year? So you set goals and then you work for them. And I'm like a cheerleader as well that will help you keep accountable for what you want to do in the next week or two.
So what are the questions that you're asking to your doctors, I guess broadly, obviously, respecting confidentiality?
Yeah.
What are you asking doctors, and what is it that you're really finding that doctors are wanting to know?
That's a good question. I think there's no one question that's the same with powerful questions. It's very much you're really present and you see what the other person is saying, and then you dig deep. So if someone's like, I can't do that. You'll be like, okay, I'm curious. You keep saying you can't do this. What's that about? And then you kind of, you go into that, and then it might reveal that you have imposter syndrome a little bit, or you're second guessing for whatever reason. When people say silly, like, oh, I feel silly doing that, that can be a big thing. Like, why silly? It could be something you've heard as a kid even, that someone's told you that what you said was silly, so you keep that word, and it's kind of a word that you hear more for children. So people, when someone says it, that's a bit of a flag too. And also a lot of getting in your body, like what are you feeling now? Because I think we can always be in our head a little bit, especially in medicine. It's very logical, practical. That's important, but also it's important to be like, how am I feeling right now? I'm tense, I'm stressed. And I think doctors really want to work on self-confidence. They want to work on believing in themselves more. And drawing boundaries, that's a big one, having personal boundaries, because we want to help people. We want to be that person that people go to. But sometimes if you let that be who you are all the time, you can feel really depleted and lead to burnout. So that's another big thing.
Okay, and why do you think that medical doctors or even medical students should consider coaching?
Yeah, I think coaching is so useful for everyone. I think because doctors are leaders in the hospital, you are the head of a team. being a good leader, you need to do some inner work, I believe, so that you can be the best person for those that look up to you. And then also it's a hard career. Like it's high stress. There's ups and there's downs. I think being able to face those ups and downs with more tools, more resources is a great thing. And if you start in medical school, even better, because you can feel really ready for internship. When you start later on, it's still possible and it's still great whenever you start, but you might already be in the stage of burnout, and then you might need more time to recover, recuperate, come back. So it's very important, I believe. And then if you really want to set goals and make them, it's another sign that coaching could be right for you.
Yeah, it's kind of interesting because the way you're speaking about it is very removed from like the wellness kind of things that we have in uni, where it's just like, oh, this is how you relax, or like things like that. And I think that's really profound, asking the correct questions and having someone there to kind of listen to you. And I think that's very distinct from therapy as well. Therapy tends to be a little bit more like kind of action based, whereas it seems like it's more you give the lead towards your client in that sense. It gives them a little bit of autonomy to take control of their own lives and ask the questions about themselves that lead them to the answers they're seeking as well.
Yeah, and you've touched on a few really important things there. I think well-being can have a bit of people cover their ears up and they're like, whatever now, because it's a bit of a token word, well-being week, well-being day, and in the internship they'd give you like a pizza or whatever, and but you weren't feeling very well. It's not a very holistic view. And then therapy is super important. It's a lot of unpacking the past as well. But coaching is just more present and future. Obviously, the past affects your present, but it's more how is it affecting you now and how can you be who you want to be moving on. And there is action in coaching. Like what action will you take now to get you there? But it's also that being and doing. So not just pure doing, not just pure being, that nice balance between the two of them.
Why do you think that so many doctors are now considering creative or non-conventional careers in medicine? As a medical student, it definitely feels like your objective is to get into medicine, get out of medicine and go straight into specialty training. Why do you think that now people are thinking about other careers in medicine?
I think it's becoming more normalized now. I went to the Creative Careers in Medicine conference. I'm not sure if you...
I've heard of it, yes.
Yeah, I also got an invitation for it and it was very interesting. Unfortunately, the times did not align with my academic calendar in the slightest, but yeah.
Yeah, it's challenging with everything in medicine. But someone said something really interesting, that there's a lot of postgraduate students that they're seeing medicine as more a job, not a vocation. So that's something
really interesting.
Yeah, and then some older people in the audiences who more end of career said they've never heard anyone say that in a medical conference before. So I think it's becoming more normalized and giving people permission to explore other things and own it. I think maybe in the past people could be secretly doing other things, like
moonlighting.
Yes. I interviewed, because I have a podcast too, I interviewed an artist who's internationally exhibited and he makes money through art. That's what he does. He's a doctor. But he would locum in a hospital, keep registration every weekend, and he didn't tell them he was an artist. And then the art world, he didn't say he was a doctor, because it's like both
That's
worlds
really
would see it's like this
mutually
identity
exclusive
thing. Yeah, but I think now it's more you can be both. You're more than a title. If you do want to go straight into specialty training, that's great. Go for it. And I know a lot of people that do that. But if you are interested in exploring other things, I think that's great too.
Yeah, I have felt there's a lot more transparency, especially in the medical field, about what people are doing outside of medicine. And I think it also empowers people a little bit to, so UNSW specifically offers the Doctor of Medicine course along with a Bachelor of Arts.
Really?
Yes.
Is that new?
No, that's been around for quite some
I
time.
think it's uncommon for people to...
It's uncommon
for people to pick it, but it's strongly offered, and it does extend the year range from 6 years to 8 years, which is... 8 years is an uncomfortable amount of time to be at uni, to be completely honest. I feel like, especially at full-time uni, it's quite a lot. But there has been a lot more offers for people to go into arts degrees or for people to do things outside of medicine while also working within medicine. I want to also follow up on that because you said, and you've mentioned a lot about locum. I don't think a lot of medical students understand that very much. It's not a very strongly advertised thing in medical school. And every so often I hear it out in the wards and go like, oh, locum. And then it's like kind of like whisper across the...
what is locuming?
Yeah, what is... basically, you're working on a contract.
Okay.
So it's more casual, it's short term. You can sometimes get locum, like longer term jobs. And it's not just hospital actually. So I think most people think, oh, you have to work in the hospital or ED. I got the clinical research job initially through a locum agency.
Okay.
So there's actually a lot of options that you might not be aware of. So basically you need to usually have had internship and residency done to have more options, at least general registration. And you can sign up to an agency. They will help find jobs, and it's when there's a shortage and they need someone for, a few weeks to a few months or more, you can say, yeah, I can fit those days, and you go. And it's just in terms of casual, you don't have sick leave or any of those kind of things that comes with a full-time job, but it is higher rates to make up for that. But usually you have to pay your own tax depending on the thing. So you're like a sole trader. You'll have an ABN and everything usually.
Oh, okay.
Yeah.
Okay, because I've seen an organisation on Instagram called Go Locum, which advertises different places around Australia that you can do locuming in. Have you been to any different parts of Australia, or has it been mainly working within New South Wales that you've done locuming?
Yeah, I've only actually locumed in Sydney.
Okay.
and only actually northern
really
Sydney.
I didn't know that you could do it within Sydney.
Yeah.
Wow.
I get the perspective that it's always like locuming to some random place.
Yeah. Backpacking to the middle of the desert.
Yeah, no, well, you can. And a lot of the jobs are regional jobs because they have a lot of shortages. And you can go anywhere, like Tasmania, Western Australia, Northern Territory. But I actually have stuck to Sydney.
Wow.
Yeah, so you can go anywhere, really.
Have you found that it's more flexible than your typical, I guess, weekly shifts as a JMO or an intern? Has locuming actually helped you to get more flexibility with your work-life balance?
Oh, it's for sure more flexible.
Okay.
In that, I don't do this, but technically you can say I can't come to this shift. You can say no to shifts. Once I sign up to a time, I stick to it unless I'm very unwell. But it's not like the typical full-time job where you can't really say no to shifts. You need to do the weekend. You need to do the 6 days a week, 7 days a week, 8 days in a row, and then full-time jobs you're there the whole year, right? Except for annual leave. But locum you can just do 3 months of the year if you want. You can do as little or as much as you want. Yeah.
Oh wow.
That's a really interesting idea, and it definitely helps with balancing other commitments, other passions that you are actively trying to build as you're currently doing. So would locum just be you would do locum on the side as well and then focus more on coaching in your mainstay kind of job? Yeah,
so I would I'm also doing my Master of Public Health. So this year it's been good in that I've been studying full-time. You can still do full-time study with full-time work, but it's definitely trickier. So I do locuming full-time in the uni holidays, and then I do full-time uni. That's what I've been doing the last year, which has been
exciting.
Yeah, it's been nice. I've enjoyed that. I'm a bit what else do I do? I'm so full of time. And then I coach. I have a few clients. I don't have a full-time roster of clients, but I have my set 5 to 10 people that I see regularly.
And how is it doing a Masters of Public Health? Has it been different to your university experience as an undergraduate?
Yeah, it's been really different actually. Now that you ask, I think med school as well is such a unique experience.
Yeah, med school is such a microcosm.
Med school is just a whole other world in itself, and I think it's almost UNSW is a lot bigger, but Western Sydney was 120 120 people or something
so quite
each
small.
year.
Oh, like each year.
Yeah, maybe it's bigger now, but when I did it, it was quite new, the university. So you knew everyone first to fifth year. Like I was good friends and still friends with people who were in fifth year when I was in first year, and it was just such a close knit, like high school almost, like continued. And I know other degrees aren't really like that. So I really, looking back, I appreciate that distinct thing. You didn't choose subjects either. I don't know if you can choose subjects.
No, we can't.
Yeah, you just like do what you're given, right?
You just prescribed things.
Yeah. And like obviously that removes decision making, which is sometimes nice as well. But Master of Public Health, it's like you choose the subjects, you choose, you're in charge of that. And it's very much like doing it in your own time. There's a lot of people who have families, so you kind of all show up when you can. If you don't show up, you listen to the recordings. It's not as much attendance. It's a lot more flexible.
That's really interesting. I think because for both of us, we are both in undergraduate, and it's almost as if uni is your entire life. Everything kind of like is there around. There's no need for like, anything extra on top of uni. You just do it, come in every single day. It is like very much like school now that you mentioned it. It is so much like high school that it's actually kind of jarring. I think as soon as you go into a master's course, it's a lot more forgiving, and it has the expectation is completely flipped, where a master's course is almost like you do it on top of the things that you're currently already doing, and there's a lot more flexibility given to you to pursue the things that you want to do outside of it. But also you are doing a course, so there's prescribed times, but they're a lot more like flexible in terms of when you want to do them.
Yeah, it's a lot more flexible. If you don't make a tutorial, you can make up a tutorial. Lectures are all, recorded. You don't have to attend a lecture. And most people are working another job while they're doing this, plus whatever else, 3 kids working a job. Like everyone has many things that they're doing.
And so a very different life stage to being an undergraduate medical student just fresh out of high school.
Totally different.
How did you find it working as a junior doctor during COVID? Did you think that, I guess your experiences there have influenced the way that you're coaching your clients now?
Well, going through COVID as an intern, I think everyone that went through COVID had a difficult experience in some way. And I know a lot of people besides myself went through internship through COVID or whatever stage of their career in COVID. Were you guys first year medical student?
We were both in high school.
You're in high school, okay. I think what was unique about internship in 2020 is that how unknown everything was. We didn't have enough PPE. We didn't really know what we had to look out for. Every week it was different information. Like we have to screen people from Wuhan, actually no, from China, actually no, anyone from overseas, now anyone with a fever. So it just rapidly progressed to then March lockdown. How do we treat it? We didn't really know then. How do we test for it? We didn't have rats
PCRs,
then. We didn't have proper we had PCRs, but it was like, it was within 12 to 24 hours. It was like 1 to 2 days. And then it was like 60 to 70% accuracy.
Whoa, with PCR? Oh no.
It was like, well, now it's much better, but it was like someone to be negative, and then you would, we can de-isolate, and then you'd swab them again, then they're positive, and you're like, oh crap, and you have to, and you had to like, that's happened to us, and so I was off for 2 weeks, thinking I had COVID, because I attended a Code Blue, and they were like, I was really close you didn't wear PPE all the time, then you actually were told not to.
Because there was a shortage, right?
There was a shortage, and they didn't want to scare people, because they were like, we don't really know yet if this is a pandemic. So you didn't wear masks all the time, only when you had to see someone that was COVID positive or possibly positive. So I had 2 weeks off. I was like, oh my God, am I going to get COVID? Am I going to die? Like, I didn't deep down, I'm like, I don't think I will. But you don't know, right?
Yeah, of course.
Because there was no vaccines then either. So it was just...
Oh yeah, you were going like completely raw.
completely no vaccine, no mask, no anything. Like I didn't know. And no treatment really back then. No one really knew how to treat it. So it was just they kept saying unprecedented times.
Yeah.
But it lasted a long time. So, yeah, and then the hardest thing, I think, was the shortages. Because, I was down for 2 weeks, so and my whole team was down. So people had to plug that shortage up while I was out, and then vice versa. Like a lot of covering and not having enough people to cover, and just kind of pulling together and trying to make it work. Ward-based care instead of teams, to try to have enough people covering enough patients. So yeah, it was difficult. And internships
On top of that, internships difficult
itself.
in general.
So it was not easy. And has it affected how I coach? Is that the other part of the question? I think the pandemic has affected how everyone. Well, this is a big generalization, so I probably shouldn't say that. I think the pandemic has sparked a lot of people to rethink things. And you saw those. I think on LinkedIn they were talking about this. The resignation, that widespread resignation that happened across the world. All this COVID and near-death experiences and lockdown has people rethinking their lives and what they want out of it. So coaching has a bit of a resurgence, I think. I think people in Australia don't know much about coaching either, and it's becoming bigger. And then also medicine as well. We now have a Doctors Who Coach Doctors group in Australia that's new. Okay. And COVID has sparked that. So I don't know if it's changed how I coach per se, but it's definitely affected how people are approaching their lives. So, I don't know if that answers your question.
Yeah.
It does.
I thought it was really interesting when you were talking about experiences as an intern in COVID, that when we had COVID and we were unsure in high school, essentially about what this was. We got told conflicting information about everything. Now, looking back, I think it was really interesting to imagine like the doctors who are working in COVID environments would have had very little more information than us. Like they would have known obviously, all the medical side of things, but they would have had very little additional knowledge, and the uncertainty of dealing with COVID patients constantly, as we just said before, like just going in completely raw almost, having no protection and having no assurance that you were safe, but still working in conditions that were actively quite dangerous. That's a very interesting perspective that I think when us going through medical school, we don't get exposed to that much.
No,
because
you're scared to take risks.
Yeah, exactly. We're a lot more safe nowadays, I guess. Nowadays, in like the past few years almost. And it's really interesting to see like when the pandemic first hit, how different of an experience it would have been for doctors going on the front lines, especially interns going into front lines with not that much experience within the hospital and having to fight probably the newest kind of infection of many days.
Yeah, it was crazy times. So a lot of it was logistics. Like we had a dementia ward, like high care dementia, geriatrics, all exposed. Like how do we keep them from wandering to other people's rooms? You can't lock someone in a room.
No.
Yeah.
So it was just things like that. Where do we put all these people that
just things you don't think about?
Yeah. So
until
a lot
it becomes a problem.
Yeah, a lot of it is thinking about logistics and with COVID and managing the spread. Wearing goggles, that became a new thing. Like you just always like it was just always something new. And now luckily it's just so protocol. Like there's such a strong protocol. You just know someone's got COVID, easy. Bam, 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 bam.
There's like a sheet on the walls.
There's a
what
sheet.
You do.
What antiviral or this medication interacts. Yep, we'll do this one. IV, oral. We've got it down pat now. But before it wasn't as straightforward. That's for sure.
Yeah.
And I guess that sense of uncertainty, it's not just COVID, it's also elsewhere in life. And I feel medicine does have a sense of uncertainty of what are you going to do in the future? What are you going to do with your MD, if you will? What advice would you give to people who are feeling a bit uncertain about what they would do in medicine?
Yeah, so much uncertainty. And not just what you will do with your life, but medicine itself.
Yeah.
I don't think that's spoken enough about. diagnosis uncertainty, strange
Yes.
presentation
Oh my God,
uncertainty.
yes.
You can do all the right things, but you don't know how it's going to turn out uncertainty. You don't get many textbook presentations as you think you would. When you do, it's actually like, oh my God, they were just like the
yeah,
textbook.
it was perfect.
Yeah,
Just
like
had
this is a teaching
appendicitis.
case.
yeah, exactly. Like great teaching case. But actually that's probably the rarity. So there's definitely a lot of uncertainty and I think you don't realize that as much in medical school. And then even as an intern, you start to realize how much uncertainty there is. And even bosses aren't always completely sure. And it's normal to have that. In terms of life, getting comfortable with not knowing,
Yes.
which is very hard. It's easier said than done. Getting comfortable with the idea of failure is a big thing. And I think for a lot of doctors and medical students, at least in coaching and people I've spoken to, that's really difficult because everyone's very capable, everyone's very high achieving, fast learners. Some people are more perfectionistic, have some tendencies towards that. So the idea of making a mistake can be terrifying and paralyzing. So what advice, was that the question?
Yeah.
Sorry, what advice?
Yeah.
Yeah. So how to get uncomfortable with what you're uncomfortable with and just going there. I think don't completely avoid it. Just try to get curious with yourself. So get curious is a big thing. What am I avoiding here? What am I really scared of happening? And why am I so scared of this? What would happen if that happened? And then the more you get comfortable with that, the more you can just explore and go for things and make choices based on what you really want and believe rather than make choices on fear or avoiding.
Yeah.
Yeah. In your coaching, how have you seen, I guess, talking to people about what they're scared about or their fears in medicine? How have you seen that change the way that they view their career and actually physically change the trajectory of where that's going?
Yeah, I think the big thing is self-talk, honestly.
Oh, really interesting.
Yeah.
Really?
So self-talk, because you can expect, even in when you're a coach trainee, you can be like, oh, I want this massive change and this amazing, transformation, which happens.
It's regrowth.
Sometimes there is this really great transformation moment, but also it's a lot of little things, and someone doesn't necessarily need to change their whole life drastically and leave their husband and move countries and quit their job.
Do your Rapunzel moment.
Like you don't need to do that. It's they can still be in their specialty, still be in their job, but the way they're showing up is, instead of going home and beating themselves up about everything that they did wrong, being like, I'm really proud of this and this that I did today, and I have left space and time for myself to do the things I also enjoy outside of medicine and to see some friends. And today I said no to this person who was stepping on my boundaries, and they've been doing this for a long time, and I use that time for this really helpful thing for myself. So self-talk is huge. Also giving yourself permission to play, permission to explore. Yeah, and I've seen people explore things outside of medicine, and then they might want to come back, and that's fine too. So, yeah, the self-talk is the biggest thing.
Yeah, that's really interesting. That's a very fascinating concept. I think a lot of people in medicine have this type of like productivity debt that they feel they have whenever they're doing anything. It's like when you wake up, you have a certain amount of productivity that you need to do in the day, and you just do everything that you can. You want to try to be as busy as possible until eventually you finally finish the day, and then it's like, oh, I can finally relax.
Or just collapse into a heap.
And then like you feel as though after all of that, and only after all of that, can you relax for a few minutes before bed, but be aware that we'll be right back up again bright and early the next morning.
Yeah, that's a huge thing as well. Permission, just saying I deserve rest. Like I deserve this time to rest, and rest is an active process. I really believe it's not. This is just an absence of. This is just me doing nothing. It's you actively resting and restoring and nurturing yourself so that you can do your best. And if you are constantly on that kind of debt of
Yeah.
never rest, go,
Like
go.
self-flagellation.
Yeah. And I definitely have been there. And it's almost this kind of, I don't know if you've seen Inside Out too.
I've
Oh,
heard.
we need to see
Yeah,
it. Yeah.
Yeah, but there's one of the new emotions is anxiety.
Spoiler alert.
Yeah, spoiler alert. It comes early in the movie, so it's
Yeah.
not too big. But it's, I felt very self-identified at times because this thinking A, B, C, D, next step, what do I do? Go. And then
The survival mindset.
And you have that, like you said, you collapse because your body's finally like, oh, and then for me, I would get sick. As soon as I relaxed, for some reason, my body I would get sick, maybe because my body's like, finally you can stop, but now you can.
It feels there's something uncomfortable almost, I think, which is not healthy, but it feels as though there's something uncomfortable about doing nothing at all, especially with, I think, medicine attracts people who have done extremely well in high school.
Or just good at being busy.
Or just good at being busy.
Good at being busy. More than study as well. Like usually you're all rounders.
The extracurriculars and things like that. It feels as though having time to relax is an invitation towards, well, it's almost a suggestion that you could be doing something productive at this time on top of whatever you're doing as well. Opportunity
cost.
Yes.
Yeah, opportunity cost. And I do think a lot of it can be avoiding things too. Like it's like if you just keep yourself busy, you don't need to stop and be like, wait.
This is a really interesting idea. It's busy. Being busy is something that's extremely comforting because no matter what you do, you will succeed at being busy. Like it's something that you can easily succeed at being because essentially, if I'm busy, then it's very difficult to not. If you want to be busy, very difficult to fail at being busy because you can just add more things to do.
And you can look busy.
Yeah, it's so easy to look busy.
Look very busy and flustered and like, I've got so much to do. Yeah. I think it's hard to let yourself just be still and being still is important. And that's why I say doing and being, like action is really important, but also just being and being like, wait, I feel like I just need to lie down for like 20 minutes. That's okay. And I really believe that getting that earlier on in medical career is important, having that mindset, because burnout is so common, like over 70%. Some figures say up to 90% of healthcare professionals have burnout or some sort of burnout in the last 12 months.
Why do you think that's so common?
Well, I think
it's like obviously there's the career part of it, but do you think there's other factors in play, or do you think it's just the nature of the career?
Look, burnout is definitely a systemic thing, as well as some individual factors make you more prone to it. So it is a difficult system in that there's a lot of shortages, COVID, the pandemic, that really pushed things over the edge. It's high stress at times, a lot of decision making, and you're busy in the ward. You're busy on any given day, even when you're fully staffed. It can be quite busy. So that, plus if you had that tendency to be very perfectionistic, you don't allow yourself to ever rest because you're like, well, I'm wasting my time. I could be doing something right now. And if you're very self-critical as well, so even if you're home and you could rest in the afternoon, evening, you actually spend the time going over all the things you did wrong that day. And just you don't sleep.
The hypervigilance auditing of your day.
Exactly. And you might stay up all night being like, oh, and I did this wrong. Oh, did I chart that? Or did I forget to do this? And then half the time you go back and you're like, I did do it. But you just run through the day. That is a recipe for burnout. And then boundaries is there's another huge thing. Having kind of weak boundaries is another thing that makes you more likely to have burnout. So, yeah.
And do you think that's contributing to the new, rise in people wanting a creative career in medicine? That thing of actually clinical medicine is pretty tiring and actually it can be pretty demanding at times. Do you think that's played into that?
I think probably. It's hard to say why why certain people want to look for a creative career. I do see a lot of people on the creative careers in medicine Facebook page more just wanting.
There's a Facebook page?
There's a Facebook page, yeah. I don't know if you're on Facebook still. I know it's a bit outdated, right? TikTok is another thing. I don't know what you guys are on.
We're actually still mostly on Facebook.
You're still on
I
Facebook?
would just be
University's
shocked that,
Facebook.
I'm just shocked that
I
there
have
is
a
a
Facebook page.
of creative careers in medicine.
Yeah,
Oh,
or
yeah?
group. Sorry, group.
Yeah.
Okay.
Not page, group.
Yeah.
My bad.
Mm.
Anyway, so I see a lot of people posting on groups like this. There's also a group doc to doc. And it seems very much like they're completely just burnt out and exhausted and they want to stop.
Mhm.
Right. And I think that is very different to exploring a creative thing.
Yeah.
If that makes sense.
Yeah, that makes sense.
Yeah. So sometimes it's more you want an escape and an out and you just don't want to do, you don't know what you want to do, but it's not this.
Yes.
Which that's a whole other thing in itself. And then there's people that are like, this is something that I've really always wanted to do and I want to explore it. I think burnout is more that I want to stop
Yeah.
and I just want to do anything but this.
Yeah. It's I've always thought that medicine is one of the most sunk cost fallacy careers ever, because you go in, you do so much, you work so hard, and medicine's not an easy course to get into by any stretch of the imagination. And then it's a very difficult and extremely long university course, after which you are qualified to do very little beyond being a doctor.
Well, that's
like,
not true.
And like it feels as though you're doing like, it's very like, I guess being a doctor is so specialized that it's very difficult to see the transferable skills beyond that.
Yeah. Yeah. Well, I think that definitely sunk cost fallacy is a thing. And some people maybe realize medicine's just not their path at some point. And it can be very daunting to admit that or say that to people, to yourself, let alone other people. Because you've spent so many years doing it, you know, it's a lot of money, it's a lot of time, it's a lot of energy, and realizing that you don't need to wait till a certain point. Like some people, like it'll get better at this, it'll get better then, but just working to make things enjoyable to live now is really big and important. I think not to when you've done specialty training. But there are other things that you can do with a medical degree. You don't have to do the traditional, you know, surgery, BPT, or pediatrics or GP. There's non-clinical specialties. Like my friend just went from crit care to pathology training.
Oh, okay.
So there's medical admin, there's radiology, public health. There's actually a lot of specialties that you might not know of. Rehab is separate to physician training. So there's a lot of options out there. I think just get curious, explore, research. And then outside of the actual colleges of medicine in Australia, you can do industry work, like clinical research, medical devices, therapeutic goods administration. You can go into government work. There's a lot of things you can do that you think you might not realize. So if anything that I would want to say today is to don't think that you're trapped or stuck in what you're doing and that there's no way out and there's nothing else you can do. There is something out there. Medical writing people do. You know, there's so many things. And also you don't need to do the list. If you Google alternative careers for doctors, you don't have to do that list either. Like people work in insurance and consulting, medical advisory jobs. There's a lot. You can work for Bupa, the immigration service. They do screens for people. They're always hiring. And then locum work, if that, some people just stay locuming forever or a CMO forever. If that's your jam, then, you know, go for it. And then if you want to do something completely different, which some people do, you can. And transferable skills, like what do you do in medicine all the time? You speak to people, you have communication skills. What do you do on a busy day when you have so many jobs on the ward? Do you prioritize time management? Triaging. Hard worker, right? Hard worker, fast learner. There's a lot of things, and you can tell people, look, I am an expert at learning fast and being adaptable, so I can learn quickly what I need for this job. So there's a lot, like don't sell yourselves short. And yeah, just explore, I think, and see what options you have. Doing internship is, I think, useful. But if you really
can't. So
don't
run away before then.
Yeah, but if you really, really can't, like I would never tell anyone to do something that they're like, no, like this will just really damage my mental health or physical health and I can't do this. Like, listen to yourself. That's why I don't tell people what to do in coaching. I'm like, you know what's best for you. I can't know what's best for anyone because I've never lived in their shoes, right? Yeah.
That's so helpful. Because I think we definitely do especially at UNSW, we have quite.
We need a lot more.
We need a broad view because it's a fantastic program, but it definitely is because we're so exposed to hospitals and I guess BPT, surgery. It's almost just a norm that's exactly what you're going to do. But it's so lovely to hear that there are options available and that actually your degree can open up a lot of doors that you may not have considered otherwise.
Yeah, it can. It can. And, you know, it's really common. It's not just UNSW. You know, medical schools are based around hospital placements, which makes sense, right? Sometimes GP placements. I don't know if you get many of those.
Yeah, we do, I think.
There are, but not
as
significant of a part of the syllabus.
Yeah, like personally, I had so much general surgery. Like I've done general surgery so many times. Like I don't even know, and I've never wanted to do surgery. But for some reason, I always had that even as an intern. Like I had so many surgical terms. And, you know, it's useful in that I can examine an abdomen well now.
Yay.
Like that's like, okay. But you get, I think it's hard to dream. It's hard to be what you can't see, right? Like that's saying
you don't know what you don't know.
You don't know what you don't know. And recently I went to my old high school to speak to students who wanted to get into medicine. And I'm like, wow, like it really took me back because in high school as well, you don't know what you don't know.
Oh,
you
that's
don't know
so
that you're
interesting.
signing up for something that has training afterwards.
You don't know. And then, these girls are really switched on.
Okay, that's good.
Like I was really impressed because they were like, you know, I don't really like speaking to people that much. So I'm thinking maybe medicine's not for me. And I'm like, it's great insight. Like, nice work you're thinking about these things. Or someone's like, I want a, you know, really well-balanced lifestyle. I'm not sure. Like, so it seems they're doing a better job now at teaching. And then also when I did high school, it was like law, medicine, pretty much it. Like that's all I really knew. Or engineering. And now
comp sci.
So but now they actually are giving a really big broad range of jobs and bringing in people from different areas. Not many artistic areas, but you know, I have faith that will change too. So I think just seeing what can be possible really opens things up. So if you feel like you don't really fit somewhere, you can make something fit for you.
And you mentioned you have a podcast. Do you chat about all this on your podcast?
I do, yeah. Yeah, so I interview, I pretty much interview only doctors. I'm trying to think if I've interviewed a medical student yet. No, all doctors. Sometimes a nurse, that's changed as well. A lot of authors, the international artists that I said, which I really love because I really love people that do something completely different. That's fun.
That's really interesting. Yeah,
so it's cool. Fun. And then there's people that, you know, they are doing traditional, quote unquote, traditional paths, but they also are doing other things. So like they are doing physician training or they're a specialist in that and whatever they are doing, but they also are an author or they also do this business in something like they're an entrepreneur, you know, so I think it just shows that you can do whatever path you want in medicine and then also make it your own.
And if people, our listeners, would like to listen to your podcast, what's it called and where can we find it?
Yeah, you can find it on any platform. It's called the Balanced Medics Handover Podcast. So, the handover in terms of, you know, when you go and you hand over to the guest. Some people from other countries don't get it. And I'm like, do they not call it handover there or something? But like, I feel like in Australia, it's a big thing. Like, you go to handover.
Yeah.
But yeah, that's a podcast. So you can find it Spotify, Apple Podcasts, everywhere. Yeah. At the moment, I'm doing fortnightly episodes.
Okay.
Oh, we should put a better plan in terms of when we release episodes.
I used to do weekly.
Yeah. And then got too much?
I think I was putting pressure on like I just need to get a guest, and now it's like I want to interview people that I just really want to interview, and I love all my guests, but it's like, you know, that pressure to find people, and now it's like, oh, this person, it's more organic now, I'd say, like it's good. Yeah,
that's so fair. I think this is more of a personal question from us. How did you guys like start podcasting, and what have you learned from the podcasting experience?
How did I start? I listened to a lot of podcasts at first, and I love Heather Falk so if you don't know Heather Falk, she's great as well for anyone who's looking for alternative things. She's from the US, from Texas, and her thing's called The Doctor's Crossing. And she does a podcast that interviews people doing all different things. She's also a coach now. She was a dermatologist.
Oh, wow. Okay.
She's stopped completely dermatology for like the past 20 years now.
Wow.
As you do.
Yeah, she's doing really well as a coach full time.
Mm-hmm.
And I was like, wow, this is so interesting. It's just very US based. And I was like, it'd be really cool to have an Australian version. And I guess I just wanted to make something that I wanted as a medical student, that's why I did it. So I just started. I went to one workshop at a conference, a medical writers conference, which was about podcasting. So I'm like, oh, good. I've been thinking about starting this. And then I'm like, all right, I'm just going to start it. And my husband's a musician, so he had this microphone. Yeah, it helps. And he's also an advertiser by training. So
that helps a lot.
That helps so much. So all the beautiful website I have, the logo I have, the color palette, that's a lot of his help.
Oh, wow.
He did the logo and he helped with my color palette, which has changed over time. But that's really important because you don't realize how hard that is. Or, a well done logo and color palette and branding is actually a lot of you need a lot of experience to do that well. So I just started and I messaged guests and everyone basically said yes. Very few people have said no. And I was like, oh, I didn't expect people to be so open to this. I'm not a big name. And then it just kept going and I enjoy it. It's a lot of fun. And I think that's also why I'm doing fortnightly. I want to keep it fun.
Well, it has been such a pleasure to chat with you today. Thank you so much for coming onto our podcast.
Yeah.
It's been so good to have the perspective of another podcaster and a doctor who's done something a little bit different in medicine, but something that I think has really been helpful in broadening our perspectives of what it means to be a doctor and actually how you can use your degree in so many different ways.
Thanks for having me. It's been really fun to come into an in-person studio as well. Yeah.
Thank you.
Thank you. And see you guys next time.